Rich, thank you very much for joining me.
My pleasure.
Quick conversation at HPCLC. So please introduce yourself.
I'm Rich Romano. I'm with Bristol Myers Squibb. I'm Senior Director of Transportation globally and storage for primary distribution only. So primary is our APIs, our drug products that are moved around before they're going to a DC for sale to a patient. So everything before.
Okay.
And also the inbound to manufacturing. So anything that's used, that it's a component or an ancillary that's used in the manufacturing process, that's also my responsibility. Well, I say mine, my team's.
Right.
Yeah, my team's responsibility.
So as Director of Transportation, what keeps you up at night?
Everything.
Regarding work.
Yeah, everything keeps me up at night. If you look at the world's a little different than it used to be. And I think now, because of COVID, everybody has a heightened sense of awareness to global issues and problems. So if you take the Russian invasion of the Ukraine, that created a whole series of events for us and how we were going to supply to market, right? So we had to take all these steps. So that was keeping me up for a while. And then, you have the hurricanes. Hurricane hit Florida, right? So I just told you I wasn't in charge of secondary distribution, but they come to me as a SME to say, well, what do we do? Should we shut down ahead of time? Should we close these areas off because our drugs are moving in small boxes that are going to go to a patient who needs that drug? And it keeps me up at night because the packaging is good for, let's say, 5 days.
Right.
And then if you count a weekend in or if you count a disruption. So we have to kind of do some thought process. And we have it down pretty well. We subscribe to a lot of services that tell us about any type of disruption, whether it's weather, political unrest, volcanoes, earthquake, anything that's happening in the world. But that usually keeps me up a lot. But what keeps me up the most is I don't feel like enough people are entering the logistics world.
Oh,
and
interesting.
I saw really big companies, I won't mention names because I don't want to mention the actual names, but really big companies who struggled through COVID to get people to work and do the jobs. They get plenty of people that will do your job or my job. But when I started with DHL in 85 and UPS in 78, it was entry level. You did manual bookings or you worked a truck or you loaded a truck. And I don't see that happening. And I worry because I think there's going to be a gap in getting people and having the robotics or autonomous type of things to do that work. So that keeps me up a little bit. Right? So we saw it ourselves in the warehousings we use where staffing became an issue. You have to pay a little more. You raise rates up and our rates are static, but we have to pay more for the workers. So I think that workforce is so vital, and I hope that more young people would take a journey instead of looking to end up go to the destination first. Take the journey to get to the destination. You'll learn a lot along the way and you'll become really successful at it.
Yeah, that's really interesting. I suppose like today we talked about how, everybody is looking at the sort of how do we become that autonomous supply chain. Like you say, people are looking towards that and not necessarily looking at working their way up through learning the nuts and bolts of logistics.
Yeah, and I see it in other industries. I mean, if you go to a restaurant to eat, sometimes you're waiting outside to get in a restaurant, not because they don't have a place to sit you, but they don't have enough cooks or they don't have enough waiters and waitresses. In the older days, people always took those jobs just to make extra money.
Yeah.
So, and I think it's a ripple effect. So I think we're in a cycle, but I don't know if the cycle will cycle out or if it's the new cycle that we're into. So eventually, maybe you'll go to a restaurant. They have them now where you have iPads, but maybe all restaurants would be you just put in your order on your phone and somebody just comes out to give it to you, or you go up to the counter and get your food. It takes away that whole romance of it, right?
Yeah.
And I feel the same way when it comes to supply chain. You see drivers now, Amazon is, I don't know how much money they're spending, but I know it can't be profitable because I have 5 drivers show up to my house delivering 5 different packages that UPS or FedEx would deliver with 1 driver, but the price doesn't matter to them because of the way their algorithms work on getting products. So, but it doesn't work that way for the pharma world. You know, our products have to be maintained at a very strict temperature. We have to ensure that our packages aren't thrown around, shock and vibration. We have to make sure that the product gets delivered to the actual assigned person,
Right.
because some of those products could be very dangerous, and we don't sell anything that would be abusive type of drugs. We only sell oncology and other drugs that help with ailments, but it's still very restricted. So if they can't get those type of drivers, or we can't do it, we have to figure out a different way to do it.
Right, and you'll charter an airplane if you have to.
We will. Luckily, I mean, I'm knocking on marble, not wood, but luckily for us, I mean, I'm very proud of the fact that through COVID, we did not charter one plane.
Okay.
We rely on our relationship with our providers. I think we have the strongest relationships with our providers. We have monthly meetings, we have QBRs, we have informal get-togethers. We ensure that our providers know who we are and what our needs are. So, and I think that was a differentiator for BMS, that we had, you know, companies that we did business with who knew our products and knew how important they were to move. You know, we bring our customers, our providers in, and we show them our patients. We share videos. We talk about what we're really doing as a company openly. So we don't really try to hide anything. We're not looking to get the best price. We're looking to get the best service, and to make sure at the end of the journey, a patient gets a product that is going to do what it's supposed to do when it gets to them.
That strategic collaboration is imperative to making sure that happens.
Yeah, and we do it with also, you know, the companies we use to transport, like your own, that have packaging solutions. I mean, we look for the right type of container to use. It's a process. It takes a really long time. I mean, companies like yourself, you'll waste years, and I don't mean it to say you're wasting time, but you'll waste a lot of hours and time to get into our company, right? And then eventually it's a payoff for yourselves, but it's also a payoff for Bristol Myers Squibb, because we can move those products safely in the right temperature.
Right.
Yeah.
As a global manufacturer, what do you see as packaging trends for global bulk freight?
Global bulk freight, I mean, we're probably a little behind because we are slower to move. We'll consider us to be one of the more conservative companies. We take a really long, thoughtful process to get through it. So I think passive, right, is the future. I think active will always have a place, because you're talking about bulk. I'm sure that there's going to be some wraps in the future that will be really very effective at, you know, they're effective at 15 to 25 now. They may be more effective at 2 to 8 at some point. But the one of them that I'm thinking about, and I don't see enough of it, is the deeper cold. You know, the minus 20s, the minus 40s, the minus 80s. You know, we have certain things that we move are at minus 80. So we have to come up with very creative ways of moving it. You know, most of it involves dry ice. You know, there's a dry ice shortage in Europe and in the United States, and multiple reasons why it's happening. But these type of events really show you the gaps and why you need more type of packaging to get you through it, because you can't always do it. Also, you talk about COVID, everybody started using containers more frequently. So the usage of containers went way up.
Yep.
So now, if you only have one way of moving it, you're going to wait till you have the containers. Where if you have multiple ways of using it, and you set your SOPs and your compliance that you can use either, then you can start moving your shipments much more freely without worrying about, is it this container or that container, right?
Right. To have that choice is...
It's vital.
Right.
It's vital. I mean, in COVID, you know, really, I think brought it to the forefront. I've been there for 5 years, so when I first came in, I talked about it, and not as many ears were listening as they should have.
Okay.
And now, everybody from the CEO down are listening, because supply chain all of a sudden became a hot commodity, because there's issues, real issues.
In terms of having that choice for the right lane, the right product, that contingency, the time needed, how do you see the Pegasus ULD fitting in with those choices?
Yeah, I think it's a good choice because it has the capabilities we need. Now, I don't know what the fleet size is or what your plans are to expand the fleet or how long it takes for you to build, your fleet size up. But I know that if you build it, they'll come.
There you go.
It's an old saying. I watched what's the movie? I watched it on the plane, the baseball movie, right? Yeah, I just watched it on the plane with tears coming down my eyes. And that's the saying, right? If you build it, they will come. So I've been at this for a long time, and I remember when, Envirotainers ran on ice with batteries. We used to buy tons of D batteries, and the fan would blow, and it wasn't really as accurate as they are now with active. And now you guys have passive units, and these are tested, and they hold it for so long. You move it into an area, they recharge, and phase change conversion has really made a difference. And I think there's much more to come, but I do worry about, and I'll go back because I don't know enough about the colder temperatures.
Okay.
The minus 80s, and our cell therapies, we have to move in cryoports, right? So we have to move them in dewars with liquid nitrogen,
right?
Because there's no other way to do it that we know how to do it. Well, it was a pleasure talking to you.